Okay, hopefully I don't hear myself echoing again like I did earlier. I think we're live on Facebook. Hopefully so. Well, I'm Angie from Daisy Family Health, and we're doing our weekly Daisy discussions, talking about Daisy Family Health Care for you and your family. So welcome. Thanks for joining us. This is the same PowerPoint that I show every week, but sometimes I like to answer questions that people may have. Maybe you haven't seen this PowerPoint before. So let's get into it. And so Daisy Family Healthcare is a direct primary care membership. And so membership clinic, I'm sorry. And so that means we follow the direct primary care model. And that is an agreement between you and your provider. All right, so you're a healthcare member as part of this organization, and your membership cost is going to include all your visits throughout the year, discounted labs, discounted medications, imaging, and then because we are integrative, we also provide some other services to kind of help keep you out healthy. So we like to focus on prevention. And so we like to consider ourselves driven by our members, not insurance companies. And so our focus is on the member. And we have a comparison chart here that will compare direct primary care to insurance-driven clinics. And when you're a member of Daisy Family Healthcare, you feel like you're part of a family, and we actually get to know you as your provider. And it's not this assembly line care where your visits are every 15 minutes. There's got to be a new patient in. You got one problem to talk about, and we got to get on to the next patient. So it's totally different. So I'll kind of go down the bullet point of the insurance-driven clinic. The primary care provider, their load is going to be a lot larger. So they may have 2,000 to 3,000 patients, and the visits are shorter. The wait times are longer, and it's hard to build a relationship with your PCP where they really can get to know you and sit down and listen to you. It's just really challenging. And they usually cannot call you back within an hour or a couple hours of you calling them, or message you back, through text like you can with direct primary care. And then depending on your insurance, you will probably have a copay, or you may have to pay for the visit in full if you have a high deductible plan. And so with direct primary care, there's no copays when you come in. You get unlimited visits, whether it's in office or it's telemedicine. And there's a small patient load. And so we max out at 500. And then depending on the acuity of our members, it may be even smaller, maybe 400 or 350. So the 500 is the max. And then we will have a wait list. And you don't wait when you come in. If your appointment is at 3, you check in and you're here at 3, and you come back at 3, I'm sorry. And so we have 2 locations, one in Glendale, one in Goodyear. The Glendale location does have a check-in tablet where you check in, we get the text message immediately, and we come out and get you. In Goodyear, you just walk right up to the suite. And if I'm with someone, our members have a direct line that they can text us. If you text me that I'm out here, the door is locked, I can come right out and grab you. So there's no long waiting. And the relationship is very detailed because I'm coming out to get you. Yeah. I'm gonna be the one texting you back and calling, or Charnette, she's the other provider. We have Johnny here, but he may intercept at some point with the members. But when it comes to once you become a member, a lot of the interception is the provider. He's more on the business side. So if we're busy, with the patient, he might be the one that'll text you back initially, or if you call, but otherwise, yeah, it's the provider coming out to get you, the provider doing your vital signs, provider drawing your labs. And not to say that we won't ever hire a medical assistant, but even if we do, it's still going to be very personal. It still is. I, I like drawing my own labs. I don't mind at all, and I like starting my own IVs if we're doing a vitamin infusion. So, um, but I'm kind of territorial over my patients because I like to know you. I like to know everything about you. And so, as a new member, the visit's going to be 60 minutes, and it seems like a long time, but once you get to talking about yourself and telling us your story, it goes by pretty quick. And then as a follow-up, the visits are usually 30 minutes. Now, sometimes as we learn our members, like I've had some where I'm like, okay, this needs to be a 45-minute appointment. 30 minutes is not enough. And that's on a case-by-case basis. So we do have time for you, and we do make sure we can block out time if we need to. And so you build that relationship. And we can return your calls, we can answer your text messages, your emails. Depending on text is kind of best if we're in between visits, because we can text you before we go in another room or something. Of course, we tell you if it's urgent to give us a call. So we give you different pointers on how to get in touch with us. And then, labs, supplements, medications, everything's discounted. Now I know this is live on Facebook, but I don't have Facebook open. So I unfortunately I'm an amateur at this. So if there's any messages, it'll be best that you send us a message through Messenger if you're on Facebook, or you can if you have a question, you can text us at 602-344-9737. We can get text messages through that number as well. So the $1 million question is, do I need insurance? We tell people we cater to those with no insurance or high deductible or health share. So we do not require for you to have insurance, but we do recommend you have some type of catastrophic coverage, whether that be a high deductible plan that you bought off the marketplace, or if you are part of a health share. Health shares work great with direct primary care clinics. We have a partnership with Zion Health where they'll give you a discount on your membership through them if you have a direct primary care membership. And so if you think that you can't afford it, I kind of challenge you to sit down and look at your expenses last year on your health insurance and your out-of-pocket costs. And you'll find that it's very comparable. And our goal is to save you money. So I'm quite sure we can save you money because of our membership cost. It's a monthly cost. And then if you have a high deductible plan, if you're the average person, most people don't reach their deductible. If you have a lot of comorbidities, a lot of health problems, you may reach your deductible. But if the average person doesn't reach their deductible, I paid $700 a month for insurance and I never used it. I never did. Even my insurance now, I had my physical, and I think I've been back once because I was in a car accident and I just wanted to get some ibuprofen. And so I'm $700 a month, and it's not a high deductible plan. It would be probably a little cheaper if I had a high deductible plan. I probably could get that for about $500 a month. But my point is, we can save you money. That's my point. I had another insurance. The main one I like to give an example is I had a high deductible plan That's still $7 a month, but I had my kids on there at the time. Well, one of them, my other kids are older. And so it was a family plan. It might have been two kids. Anyway, it was a family plan, $700 a month, never used it. I think I got my annual physical, but I got sick. I had a sinus infection that year. And I went to the urgent care and it cost me $200 with insurance that I never used. $200. I'm like, so why am I paying $700 a month and it's still gonna cost me $200 out of pocket? And then when I went to get the antibiotic, it was $24. In which this antibiotic now that we prescribe, administer in the clinic is about $8. If that. I'm just kind of throwing that out there. It's probably less. But I'm like, it's just frustrating. And so I like to challenge you to check your last year spendings and see how much you spent on healthcare. And if we can beat that, I the re, is I love direct primary care. I really do. And it's because of that personal. So I tell people, even if you don't have it, even if you do have insurance, you will love direct primary care just because you build a relationship. Most direct primary care clinics can see you the same day or the next day. So you ever call your doc and you're sick and they're like, oh, we can't get you in for 2 weeks. Yeah, direct primary care is totally different. So I'm not only preaching about Daisy Family Healthcare, but I'm preaching about the direct primary care model in general. It's just an amazing thing. And so this little slide here just talks about how your insurance is going to cost you. And then depending on your deductible, you're going to get that 1-year visit that doesn't cost you anything, usually includes some labs. And after that, you either have a copay or you pay out of pocket till you meet your deductible. So I've seen copays that range from $20 up to $70. Actually seen a $90 copay, and I'm like, that's ridiculous. And then at that annual physical, that's what it is. So you can't be talking about all your complaints. So you got neck pain, knee pain. Oh, my stomach hurts. That's another visit. And then if you go to urgent care usually has a higher deductible than your primary care. So that can be 30, 50, 75. 75 seems to be the more standard. It used to be $40 for copay urgent care, but not my one insurance. I had a high deductible, so it cost me almost $200. I paid for the visit because I hadn't met my deductible. And then I think in this assembly line insurance type of environment, you receive subpar care and you work hard for your money. So I think you deserve to get personal care. And then your cost is going to depend on your health coverage. I think when you shop on the marketplace, it's going to depend on your income. Yeah. And so, having insurance doesn't make you healthy or keep you healthy, especially when you know that after this physical, all these other visits are going to cost me money. So, a quarterly wellness follow-up is kind of just unheard of in the insurance world. Your quarterly follow-up is probably going to be a follow-up on your chronic disease, right? Maybe you have diabetes. So you need to be seen every 3 months. Not if you don't have any, health conditions. Well, I want to see you if you're healthy. I want to see if you got diabetes too. But what about those who just want to follow up every 3 months to see if there's any changes and make sure, everything's going well, that you're happy with your health, maybe need some pointers on health coaching, eating, meal planning, blah, blah, blah. Yeah, that doesn't happen in the insurance world. It just doesn't. And so I encourage my members to follow up every quarter. a quarterly wellness visit. Yeah. But all new members start off with a annual wellness visit that's going to include those basic labs. If you need to add on anything, maybe you got a chief complaint, maybe you feel your hormones are out of whack, maybe for your thyroid's out of whack, which thyroid is a hormone, I'm sorry. Maybe you are tired and you got a history of iron deficiency anemia or something like that. Well, the add-on these labs is going to be very, very reasonable. I like unbeatable prices, I always use TSH as an example. That's my favorite one. That's like $3. Yeah. If you add on a hormone panel, that's going to probably be about $30 for a member. And so that's not just, estrogen and testosterone. That's going to include your estradiol, your testosterone, your SHBG, your DHEA, your FSH, what else? Oh, prolactin and progesterone. Yeah, we can get all those for about $30. Yeah. And so you get this wellness visit. We kind of see if anything's wrong and we give our recommendations. So we devising the plan. We're devising this plan and we're going to help you carry it out. And our goal is to keep you healthy. I believe everybody in the universe should take a multivitamin. So we include professional grade multivitamin in our membership. And I believe in this vitamin because I take it myself. Pure Encapsulations 1 multivitamin. That's the name of it if you want to do your research on it. It's got I always say crap load, but it's got a bunch of great stuff. I shouldn't say crap load when I'm talking about a vitamin. I like Pure Encapsulations. They've got the research behind them. And so, I'm not just giving you any multivitamin. I'm giving you something that's going to work for the benefit of your body. And like I said, I like to see people quarterly, but what if you're sick? Flu season's great come up. We still get COVID cases, you got to worry about pneumonia. You got to worry about strep. You got to worry about sinus infections. You got to worry about gastritis. You got to worry about, I fell down, I hurt my knee, now I need an x-ray. That's about 6 visits I just named. It's still included in your costs. And then we keep a lot of things in-house. Like if we have to put you on an antibiotic, we can give it to you right there. And it's gonna be cheaper than you going to the pharmacy. If we cannot beat the pharmacy prices, then we just send in a script. There's no hard feelings. You don't have to get it from us. We want to save you money. And we want to keep you out the urgent cares or emergency room. So we always try to tell you to contact us first. If you have an emergency event, call 911. If you're having chest pain and you feel like you're having a heart attack, I want you to call 911. So, and I think I just explained all of this about how you kind of start as a new member. And those are the labs that are included every year: the CBC, CMP, A1C, and lipid panel. CBC is going to check for anemia. So it's going to check your red blood cells, and then it's going to kind of break that down to the hemoglobin, hematocrit, and break that down even further, looking at the size of the cell, the color of the red blood cell, the maturity. And then a CBC includes your white blood cells, which is going to, I always say that's kind of like some sign of infection if it's elevated usually, or sometimes it could be low. Why is it low? So, and the white blood cells, that gets broken down to a differential as well. So if something's off, is it bacterial? Is it allergic? Is it viral? What's going on? And then the A1C, that's our diabetes screen. And that kind of tells us how your blood sugars have been over the last 2 to 3 months. Lipid panel is going to show us your total cholesterol, bad cholesterol, good cholesterol. It'll also give us a like a scale on your risk of having a heart attack or a stroke, or I should call it a cardiovascular event, and it triglycerides too. And I like to do quarterly educational webinars. Plan is to talk about PCOS in October. I think the world needs to, well, us women really need to deep dive and talk about PCOS. A lot of problems is related to diet. So PCOS is an insulin resistance, but a lot of times it's related to eating. And then on Thursdays is our late day, so we're available to 7 p.m. And then we're open a couple Saturdays of the month. So what is all this going to cost? That's probably the number one question. So I don't care if you guys are giving away gold, what is it going to cost? So there is a $100 enrollment fee, and that's per household, that's not per person. So whether there's one person in your home, or whether it's just you in your home, or there's a family of 4, it's still a $100 enrollment fee. And then for individuals 18 and up, it's $85 per month. Couples will save $20 per month, so it's $150. Excuse me. And then to add children is $25 per month. And the child must be on with the parent or guardian. We cannot offer memberships to children alone. And we do have business plans as well. So depending on the size of the business, you will save more money. There is a $300 annual fee for businesses. Because in our business plans, we come out to the business and we do the annual wellness visit at the business. And so we'll come out, we'll feed your employees, we'll draw their labs right there. And of course, we'll do our annual assessment. And 5 to 20 employees are going to be $85 a month. 21 to 50, 75, 51 plus is $65 per month. And then all children is the same, $25 per month. So I think we covered everything. So in the beginning, I talked about seeing that we offer integrative care. And so what that means is we basically are more than primary care, where we offer natural functional services like vitamin infusions, B12 shots, with the fat burner, without the fat burner. This winter we'll bring back out our Super B shot, which includes the B vitamins with the vitamin C. And then, hormone replacement therapy, whether it's the pellets, the injections, the creams, we offer that to our members, and the price is going to be unbeatable. Like for women, the pellet insertion is $300. For men, it's $500. And that does not include your labs, but remember, as a member, you get that discount, and that hormone panel is only going to cost you $30. Let's see, we offer metabolic detox, we offer foot detox, we offer meal planning. I am a certified health coach. I went to Institute of Integrative Nutrition, and so I am a health coach, so I like to do a lot of health talking to our members and not just feed them medication. I even if they're on medication, I like for them to kind of focus on their health as well, to try to help themselves. Let's see, what else do we offer? I'm quite sure there's more. My brain's just, we have essential oils in the office, and we use plant therapy, so we offer our members 25% off of that. Any other supplements that may be needed, 25% off. Oh, homeopathy. We have homeopathy, clinical homeopathy. And so that's 25% off. Yeah, some good things. 2 locations. Our Glendale location is 44. Sorry, I gotta fix that. It's 4494 West Peoria Avenue. I don't know why I got the 7 stuck in my head, but I'll fix that. And then our Goodyear location is 15655 West Roosevelt Street. So our Glendale location is probably, if you're coming from the 17, it'll probably take you about 5 to 7 minutes, depending on the lights. You know, if you don't hit every light, you'll get there a little quicker. If you're coming from the 101, it'll probably take you a good 10 minutes at least, because it seems like the lights on Olive are just, they're too much. If you're going to the Goodyear location, and right off the 10, it's like 5 minutes off the 10. You get off the Australia Parkway exit and you take that left or the right, depending. If you're coming from Buckeye, you take the right. If you're coming from Avondale, Phoenix, basically coming from the east, you're gonna take that left. Real close. If you have any questions whatsoever, please feel free to text us at 602-344-9737. Call us. You can call that number and you can text that number. You can email. It's probably best you email Johnny. He's the business guy. So Johnny, JOHNNIE @daisyfamilyhealth.com. And we're here every Sunday. Sometimes I'll go live, sometimes I won't. I probably won't go live every Sunday. I'll probably just do the spiel to anybody who registers, and then probably go live a couple times a month, because I really don't know how to work the live. It just was on there. I said, oh, okay, let's go live on Facebook. All right, well, thanks guys. I'm gonna go and finish the rest of my evening. I hope you have a blessed night. Like I said, if you have any questions, please let us know. Thank you so much.